Adrenaline, also known as epinephrine, is a powerful hormone and neurotransmitter that plays a vital role in the body's response to stress and emergency situations. It is commonly used to address a variety of medical conditions, primarily focusing on its life-saving properties. This video will delve into the common uses of adrenaline, provide dosage guidance, discuss potential side effects, and highlight user feedback. Whether you are curious about the effectiveness of this medication or are considering its use for a specific condition, this comprehensive guide will provide you with the information you need. Common conditions treated with adrenaline. Adrenaline is primarily used to treat life-threatening allergic reactions, also known as anaphylaxis. Anaphylaxis occurs when the immune system overreacts to certain allergens, causing a rapid and severe allergic response. This can result in symptoms such as difficulty breathing, swelling of the face and throat, hives, and a drop in blood pressure. Adrenaline acts quickly to counteract these symptoms and save lives in emergency situations. In addition to anaphylaxis, adrenaline is commonly prescribed for individuals with asthma and respiratory distress. It acts as a bronchodilator, meaning it opens up the airways and improves breathing. This can be particularly helpful during asthma attacks or other respiratory emergencies. For individuals with low blood pressure, adrenaline can be administered to increase blood pressure and maintain proper circulation. It stimulates the heart and constricts blood vessels, ensuring that vital organs receive an adequate supply of oxygenated blood. Dosage guidance for adrenaline. The appropriate dosage of adrenaline varies depending on the condition being treated and the individual's age, weight, and overall health. For anaphylaxis, a common initial dose for adults is 0.3 to 0.5 milligrams mg, injected into the muscle or under the skin. This dose can be repeated every 5 to 15 minutes if necessary. For children, the dosage is based on weight. The typical initial dose for children is 0.01 mg per kilogram of body weight, up to a maximum dose of 0.3 milligrams. Like in adults, this dose can be repeated if needed. It is important to note that adrenaline should only be administered by a healthcare professional or someone trained in its use. The correct technique for injection should be followed to ensure proper delivery of the medication and minimize the risk of complications. Potential side effects of adrenaline. While adrenaline can be a life-saving medication, it is not without potential side effects. Common side effects include increased heart rate, palpitations, anxiety, restlessness, sweating, and nausea. These side effects are usually temporary and subside as the medication wears off. In some cases, adrenaline can cause more serious side effects, such as chest pain, irregular heartbeat, high blood pressure, and difficulty breathing. These side effects should be reported to a healthcare professional immediately. It is important to note that adrenaline should not be used by individuals with certain medical conditions, such as heart disease, high blood pressure, or hyperthyroidism, without careful consideration and supervision by a healthcare professional. Adrenaline can exacerbate these conditions and potentially lead to serious complications. User feedback and experiences with adrenaline. User feedback and experiences with adrenaline can provide valuable insights into the efficacy and tolerability of the medication. While individual experiences may vary, many users report that adrenaline has been life-saving in emergency situations, particularly during severe allergic reactions. Some users have reported feeling a sense of relief and improved breathing shortly after receiving adrenaline. Others have mentioned experiencing temporary side effects such as increased heart rate and anxiety but found them to be manageable and outweighed by the benefits of the medication. It is important to remember that user feedback should not replace professional medical advice. If you are considering the use of adrenaline for a specific condition, it is recommended to consult with a healthcare professional who can provide personalized guidance based on your individual needs and medical history. Alternatives to adrenaline for specific conditions. While adrenaline is commonly used for certain medical conditions, there may be alternative medications or treatments available depending on the specific circumstances. For example, individuals with asthma may also benefit from other bronchodilators, such as albuterol or levalbuterol. These medications work by opening up the airways and can provide relief during asthma attacks. For individuals with anaphylaxis, there are other medications, such as antihistamines and corticosteroids, that may be used in conjunction with or as an alternative to adrenaline. These medications help to reduce inflammation and prevent further allergic reactions. It is important to consult with a healthcare professional to determine the most appropriate treatment options for your specific condition. They can evaluate your medical history, assess the severity of your symptoms, and recommend the best course of action. Precautions and contraindications for using adrenaline. Adrenaline should be used with caution in individuals with certain medical conditions, as mentioned earlier. It is essential to inform your healthcare professional about any existing medical conditions, medications, or allergies before using adrenaline. Additionally, adrenaline should be stored properly to maintain its effectiveness. It should be kept at room temperature, away from light and moisture. The expiration date should be checked regularly, and any expired or discolored adrenaline should be discarded. Proper administration of adrenaline is crucial to ensure its effectiveness and minimize the risk of complications. Healthcare professionals or individuals trained in its use should carefully follow the recommended injection techniques and dosage guidelines. Frequently asked questions about adrenaline. Can I administer adrenaline to myself in an emergency? It is generally recommended to have adrenaline administered by a healthcare professional or someone trained in its use. However, in certain emergency situations where immediate medical assistance is not available, individuals who have been prescribed adrenaline may self-administer the medication if they have been adequately trained to do so. Can adrenaline be used to treat other conditions besides anaphylaxis and asthma? Adrenaline is primarily used to address life-threatening allergic reactions and respiratory distress. However, it may also be used in other emergency situations where increased blood pressure and improved circulation are necessary. Are there any long-term side effects associated with the use of adrenaline? The use of adrenaline in emergency situations is generally short-term and does not typically result in long-term side effects. However, it is important to consult with a healthcare professional to discuss any potential risks or concerns based on your specific situation. Can adrenaline be used during pregnancy or while breastfeeding? Adrenaline should be used with caution during pregnancy and breastfeeding. It is important to discuss the potential risks and benefits with a healthcare professional before using adrenaline in these situations. Conclusion and final thoughts on the use of adrenaline. Adrenaline is a powerful medication commonly used to address life-threatening allergic reactions, asthma, and other respiratory distress conditions. It acts quickly to counteract symptoms and save lives in emergency situations. While it is an effective and potentially life-saving medication, it is important to understand the appropriate dosage for different conditions, potential side effects, and any alternatives or precautions that may be necessary. If you or a loved one have been prescribed adrenaline, it is essential to consult with a healthcare professional who can provide personalized guidance based on your individual needs and medical history. They can ensure proper administration, monitor for any potential side effects or complications, and recommend the most appropriate treatment plan for your specific condition. Remember, this video is intended to provide general information and should not replace professional medical advice. Always consult with a healthcare professional for personalized guidance and recommendations regarding the use of adrenaline or any other medication.